March 505 incident, man down in front of the Melody Bar. SO and OPD's on the scene, and you've arrived on the scene now, and your time starts now.
Scene safe?
Yep.
MOI, NOI?
MOI.
We've got our BSI in place, gloves and goggles at a minimum.
Good.
How many patients?
1.
And call additional resources, ALS at a minimum.
Intercepts on the way.
Consider C-spine precautions.
It is needed.
General impression?
You have a 28-year-old male. His eyes are open, his chest is rising, his hand is on the right side of his chest, looks kind of sweaty, and the cops are telling you it's okay to go in.
Okay. All right, sir, don't move your head. Can we help you?
Yes, who are you? You from the garbage department?
Yeah, my name's Paige, this is Evans, we're with Valencia EMS.
Oh, okay, yeah, good.
All right. Well, what happened to you?
Yeah. I got shot in the chest here.
Okay. Mr. Evans, can you please take C-spine for me? All right, do we have immediate life threats?
I don't know.
All right, so I exposed his chest because he was holding his right side of his chest. He had blood all over his hand.
Yep.
So that could possibly be.
Yeah, you see a hole when you expose his chest. It's a small hole, but it's got bright red bubbling blood flowing out of
Okay,
it.
so place the glove hand on it.
Okay.
Then I'm going to go, because it's a sucking chest wound,
Mm-hmm.
I'm going to go ahead and put occlusive dressing.
Okay.
Take my occlusive dressing. I'm going to tape it down on 3 sides.
Okay.
And then I'm going to also.
And you hear diminished sounds on the right with crepitus and with a small amount of crackles. The left side is clear, tidal volume is adequate on the left, diminished on the right.
Okay, that's immediate life threat, so we're going to have to load and go. But his airway's open because he's talking to me.
Yep.
His breathing.
It's
breathing
adequate
is.
right now.
So we're going to put him on a non-breather 15 liters a minute.
He's breathing 20 times a minute. 20.
Sir, where are you at?
I'm in front of the bar on Ivy Lane.
All right, so as I'm asking him questions, I'm checking his pulse, checking his skin color temp.
Okay.
Any other external imaging? He's automatic.
None that's noted.
All right, he's shocky because he's pale cool. Once we
Diaphoretic,
get him, I
yeah.
could throw him, put him on a blanket, or put a blanket over him and try
Okay.
to treat for shock.
Yeah.
So back, again, I said I'm gonna load and go. So back to my mental status. Where are you at?
505 South Ivy Lane, Obama, July the 7th.
Daniel times 4. Again, since we identified this as a load and go,
Right.
we did our ABCs.
Right.
I'm
Or
gonna-
he could have who doing that for him?
Partner.
Yeah, as long as he
Oh, we
tells
will
his
do.
partner, same as the other scenario. He
Okay.
can tell his partner to do it, okay?
All right.
So now he's found it. Did he finish his primary?
Yeah.
And there was
Got it
no
done.
other immediate life threats.
He got it done, right? So now, look what he's gonna do. Go ahead.
All right, so I'm gonna decap BTLS since it's a load and go. We're gonna put him on the backboard. So we're gonna decap BTLS's head and neck before we do that. So decap BTLS stands for deformities, contusions, crepitus, abrasions, avulsions, punctures, penetrations, burns, tendinous lacerations, swelling.
Correct.
Any of that
Continue.
stuff?
Yep.
All right, I'm gonna check his eyes.
You'll have to say it one time.
I'm gonna check his eyes with a pin light,
Yeah.
making sure they're equal and reactive to light,
They are.
raccoon eyes.
They
And
are.
check his nose for CSF, blood or any fluids. Check his mouth for any obstructions, loose teeth, unusual breath odors.
Smell alcohol, strong,
Okay,
strong odor.
noted. Gonna check his ears for CFS, vital signs, any kind of blood, any fluids.
No.
All right, I'm gonna move down the neck, decap BTLS's neck. Anything? Looking for jugular vein distension, tracheal deviation, and subcutaneous emphysema.
It's all negative, so he's cleared the neck now so he can put the collar on. And once he puts the collar on, it makes it difficult to check it, even though there's a hole in most C-collars on the front, right? And that's so we can feel for those cartilaginous rings, boom.
And the origin, can we have a ghost?
We can even do, and at this point, he can call for a ghost. Now, he's been down there getting the guy's medical history, what happened to you related to the chief complaint, because he's just sitting there holding it. So now, Professor Evans can let it go, and he's got a ghost. A ghost means we're pretending somebody's holding the head, because it's gonna take 2 of y'all to do this. You had backboarding in week 1, correct?
1, 2, 3. So since his injury's on the right side, we're gonna place the backboard on the right side, and I'm gonna decap BTLS to back, look for any muscle spasms. In this case, really gonna be checking really well for, any exit wounds.
Okay, and if he found an exit wound, what would he do? Gloved hand, inclusive, 4 sides, right? Okay, cool.
Alright, 1, 2, 3 down. Alright, so now I'm gonna move over to this side.
Notice he's moving over because he doesn't have them centered, so what do? They go down first.
Like 1, 2, 3 down. 1,
Halfway,
2, 3 up.
boom. That's the way you do it, and you do it from opposite sides. One hand's under the shoulder blades, one hand's under the pelvic girdle, right? So you're lifting the heaviest parts of the body, moving them, overcoming half the distance. If he was 6 inches off the board, you take that 6 inches and overcome half of it on the way down and half of it on the way up. You're trying to keep a longitudinal angle of the spinal column. While you're strapping them down, you can be asking the patient additional questions, right? So anything you didn't get, because remember, you're keeping that focused on chief complaint, okay? Go ahead, chief.
So I'd also be trying to get a sample. Ask them, hey, how you breathing now?
Not too good there.
Alright, how close was he when he shot you?
He was
Or did
about-
you see who shot you?
Yeah, man, it was this dude I've known him, and he shot me from about 5 feet away, and we was just standing there. Both of us was standing up, and he just pulled his gun out and shot me because we got in an argument over some money I owed him. And man, and it was even the gun that I sold to him.
This time we're transporting.
Okay, and you lift them up and boom, boom, boom. Okay. So same gun I sold to him, little 25 caliber. Now remember,
25 caliber?
yeah, 25 caliber, boom. Okay, so
Give me
that
some
was
vital
six,
signs.
about
Yep, give me
6
some vital
minutes,
signs.
30
Alright, so my
seconds.
partner's giving me vital signs. We're en route to the hospital. If you get a chance while I'm doing finishing my assessment, and you do a sample of PQRC.
Check.
Alright, so now back to my hands-on assessment.
Chief, why don't you do it from this
Yeah.
side so they can see you?
You know,
Okay.
yeah. Alright. And then, hey, once you get done with that, like 5 more minutes, can you give me another second set of vital signs?
Yeah.
Check. Alright, so back on my chest. I'm gonna decap BTLS the chest. Checking for symmetry of breathing, integrity of ribs, any other kind of flail segments, sucking chest wounds, decap BTLS, a subcutaneous emphysema.
Looks good.
I'm gonna re-auscultate the lung sounds,
Good.
paying close attention to the patient's right side.
Yeah. The injury side still sounds the same. The left side, though, sounds a little bit worse now. So what's he gonna do with that dressing? Perfect. Yep, gonna burp that dressing.
Alright, so moving down to the abdomen, gonna decap BTLS, palpate the 4 quadrants, checking for rigidity, distension, and pulsating masses, decap BTLS. Gonna go down the pelvis, push inward and downward on the wings, checking for stability, decap BTLS. I'm gonna palpate the pubis, checking for any abnormal bleeding, priapism, decap BTLS. Come down to the lower extremities. The right lower extremity, decap BTLS. Left lower extremity, decap BTLS. I'm gonna check for distal pulses. The top pulses is gonna be my dorsalis pedis and then my posterior tibialis.
Okay.
Check for dorsiflexion, plantar flexion. Then for my sentry, it's gonna be paresthesia, numbness, light touch to pain. Hey, can you feel me touching your toe?
Yes, yep. Left foot.
All right. Nervous reaction, skin color temp, and cap refill.
Paresthesia. You got
Yeah, paresthesia, numbness, light touch. Anything on that?
No, all negative.
All right, so my lower extremities are both negative. I'm gonna come up to the upper extremities, gonna decap BTLS, the left arm, the right arm, and check my radial pulses. And for my motor, hey, can you squeeze my hands?
They're equal.
All right, and then paresthesia, numbness, light touch to pain, and any medical alert tags,
And no cap refill.
any cap refill, skin
Good.
color temp
Good.
condition.
Good.
Then I'm gonna check any accessible areas of the back, just to
Okay.
make sure we didn't miss anything.
No, none, no.
All right, we'll re-auscultate lung sounds,
Okay.
because we're gonna continue to reassess.
They're the same?
Our partner will get another set of vital signs,
Okay.
see if there's any kind of trending going
All
on. So in the reassessment, hey, you still with me, George? What did we say his name was?
George.
Hey, George, still with me?
Yeah, man.
All right, so you still 800 times 4?
Yep.
Airway. How's your breathing now?
It's a little bit better, but
All right.
the air feels good on my face, but it's still a little hard to breathe.
Okay. And then circulation's the same. Check our interventions. So I can try to re-burp his wound. I'll re-auscultate lung sounds, just to
Same,
double check.
they're same.
Check our oxygen, make sure we're still flowing 15 liters a minute.
That's
Make sure
good.
the bag's still going.
Pulse
And
ox
then,
is at,
we got pulse ox on?
yeah,
Pulse ox?
pulse ox is at 78.
Uh-oh, get rid of it.
Check.
Alright, so VCC Unit 1 to ORMC trauma alert.
Trauma alert, go ahead, unit code.
This VC Unit 1, ETA, 10 minutes, we're en route to your facility, the 28-year-old male with a gunshot wound to the right side of his chest. Patient, the patient is ANO times 4 with a GCS of 15. His initial pulse was 120, BP of 110/60. His respiratory rate was 22 and labored. And diminished lung sounds on the right side, and his pupils were equal and reactive to light. Our current vital signs are pulse 118, BP 100/56, respiratory rate 22. Still diminished lung sounds on the right, and now starting to become diminished on the left. Blood glucose level was 90. We treated the wound with a occlusive dressing. Patient's got a seat collar on, long backboard, and is currently on oxygen at 15 liters per minute. Again, his current GCS is 15. You want me to get into the weapon right now? He was shot with a 25 caliber from about 5 feet away. And he was shot from the top down. You require any further?
No, we'll see you when you get here, we'll be ready for you.
Check.
And you reported no exit wound, correct?
Check.
Okay, so, yeah, now they